my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon here in Miami with a special interest in gender affirmation surgery. So in this video, we're going to talk about how patients choose a vaginoplasty procedure. And what I mean by that is when we're creating a new vagina, there's mainly, in my practice, two different ways of lining that vagina, and we're going to talk about how folks make that decision. So right now in my practice, and this reflects most of the United States, there's two main ways to line the new vagina. So we can either do what's called a penile inversion technique, and that's where we use the materials from below the genitalia, and that's going to make our external genitalia and also line our new vaginal canal. Now, of course, the holy grail of lining vagina is to try and figure out something that is more natural. And so that's why the technique of the peritoneal vaginoplasty, or the Davidoff technique, was developed. And so the hope was, by using the peritoneal tissue, we would have a more quote-unquote natural result. However, overall, we haven't really proven as yet that one technique is superior to the other. So that's why, in general, in the United States, a lot of us, or most of us, offer both procedures, and the patient decides which one is more suitable for them. So what is a peritoneal vaginoplasty? So the peritoneum, you probably have never heard of it unless you're in the medical field, is the lining of the inside of the belly. It's kind of like there's your skin on the outside of the belly, and then on the inside there's this shiny material that's like on the skin that lines the inside of the abdominal cavity where your organs are. And so in peritoneal vaginoplasty, what we're doing is we're using the materials on the outside to line part of the vagina, but then the deeper part of the vagina is going to be lined with that peritoneum. And so what happens is, in my practice, while I start creating the genitalia on the outside, a urologist with a robot comes from the inside, so makes 3 little incisions in the belly and works down in the pelvis to bring down some of that peritoneal tissue, and then we meet on the outside. Typically, the urologist brings the tissue down as far as he can, as far as he can get it, and then I connect the most shallow part of the vagina on the outside, and that creates our peritoneal vaginoplasty. I would say over the past few years, we've seen requests for this procedure really skyrocket, and it's probably become the most common way we create new vaginas now. So oftentimes when a patient comes to me for a consult for a vaginoplasty, I present both options, and then together we make the decisions. So the theoretical advantage of the peritoneal vaginoplasty is that it acts more naturally, and the question is, does it? Well, unfortunately, with both procedures, if we're doing penile inversion or peritoneal, we still need to do dilation. So that's one thing that's been a little bit maybe disappointing about the peritoneal vaginoplasty. You still get vaginal stenosis, and in my practice it seems to be at equal rates with penile inversion. It's more of a self-cleaning oven, perhaps. And what I mean by that is, with penile inversion vaginoplasty, your vagina is always going to be lined with skin. And so douching, or basically squirting water up there to clean it, is very important as part of your hygiene. However, with the peritoneal tissue, it's technically not skin, so that part is probably not as important. And that's really the most significant difference I've seen between both. Lubrication, oftentimes you still need to use lubricant with peritoneal vaginoplasty. Perhaps we get more depth with the peritoneal vaginoplasty because we're going into the belly, but we're seeing in my practice the numbers are about equal. Now, those are the possible advantages of the peritoneal vaginoplasty. What are the downsides? So it is definitely more surgery, and so whenever we're doing more surgery, there's more theoretical risk. So while, like I said, while I'm working from down below, the urologist is going into the belly, making 3 small incisions to do that, but obviously we're working around other organs up there, so theoretically there's more risk to injury to other structures or bleeding from inside the belly. So that's one downside, and some patients will say, I want to avoid that. We do see a little bit more pain with the peritoneal because obviously we have those scars on the belly which we wouldn't otherwise have, and usually in my patients that translates as to an extra day in hospital. So usually Most penile inversion vaginoplasties stay inpatient about 2, 3, sometimes 4 days, whereas with peritoneal vaginoplasty, 3 or 4 days is more common in that group. So at the end of the day, we don't have all the scientific answers. That's why we still offer both. A recent publication suggested that certainly in folks who've been on blockers and don't have much tissue to work with down below, it makes sense that peritoneal vaginoplasty has the advantage there. But otherwise, both procedures are reasonable, and we present the options to our patients and they make the decision from there.